Good afternoon. Thank you for waiting so patiently. We've got power, so we're good. I want to welcome you to our first breakout session this afternoon. And our presenter will be Dr. Lara Paludi. After her presentation, we will have some brief time for question and answer. So there will be staff walking around with microphones. So just raise your hand and we'll come over and you'll be able to ask a question. Dr. Lara Paludi is an assistant professor and director of the Clinical Exercise Physiology Lab in the Department of Kinesiology and Community Health at the University of Illinois Urbana-Champaign. Professor Paludi received her bachelor's degree from Queen's University and her doctoral degree in kinesiology from McMaster University. Both are in Canada. Professor Paludi completed a postdoctoral fellowship in the Exercise Neuroscience Research Lab at the University of Illinois Urbana-Champaign. We've heard a lot from them today with them getting an award. Professor Paludi's research focuses on the role of exercise in the management and treatment of disability arising from neurological disorders, particularly MS. She has specific interests in the application of adapted exercise rehabilitation approaches in neurological populations with advanced mobility impairment. So please welcome Dr. Lara Paludi.
Thank you. Thanks so much. Can everybody hear me okay? Okay, great. So thank you very much. No? More technological impairments here. Probably just need this higher. Okay, better? Okay. Sorry about that. Okay, so thank you so much, everybody, for coming this afternoon, for sticking around, and we're going to hear a little bit more about exercise and the benefits for people with MS. And we're going to talk a little bit more about exercise for people who have advanced MS, okay? And I'd just like to thank the organizers for today for putting on such a great meeting and for inviting me to share some of our research with you. So just a brief outline of some of the topics that I'll be covering. So let's just set the stage for advanced MS in terms of what we're talking about and the research that we've been working on. I'll focus a little bit on some of the benefits of exercise. We had a great summary this morning of some of the benefits that we found from exercise training for people with MS, and then kind of where the problems are for people with advanced MS and what might be some solutions for exercise, okay? I'm going to talk about 4 specific modalities of adapted exercise. I'm talking a little bit about what those approaches involve, what are some of the evidence that we have so far on some of the benefits of those approaches, and then kind of the potential long term. Where do we see these approaches going? Okay? So advanced MS, so we talked, Professor Model mentioned the Expanded Disability Status Scale score, or the EDSS, and this is one of the standard scales that we use to classify level of neurological disability. And this is highly dependent on mobility level and what type of assistive device you might use while you're walking. And so to put things in context, when I'm talking about advanced MS, I'm talking about individuals who have more difficulty with walking, who are using assistive devices. It could be in the form of a cane, a rollator, or even in a wheelchair. So typically what we would see kind of in the 5 to 8 EDSS range, okay? So some of the limitations for those who have advanced MS, and again, we touched on some of these things already this morning. So walking impairment is one of the biggest limitations, obviously, for those who are using assistive devices. And we know in advanced MS, we also have the loss of physical fitness. So we talked about this concept of deconditioning. So that would be things like the loss of muscle strength, the loss of our balance, the loss of our aerobic fitness levels, as well as body composition. So when we lose things like our lean muscle mass, and that contributes to our strength losses. So we know there's some changes there that happen as the disease progresses. Other things we know, certain symptoms are more common and more severe in people who have advanced MS, like fatigue and depression in particular. We know that all of these factors kind of come together to influence our ability to perform everyday tasks and that overall concept of quality of life. And so what are some of the solutions? So we heard a lot about the benefits of exercise training this morning and how exercise could be beneficial for improving a lot of these different areas where people with MS have symptoms and limitations. So we saw there were some benefits for walking and gait, so improving our walking speed, our walking endurance, improving that fitness, so that deconditioning aspect, trying to improve that with exercise training. Other things like balance and body composition, we know we see some improvements there, as well as symptoms and quality of life. So we saw a really nice summary this morning from Professor Mottle's presentation on all of these important benefits. And so one of the biggest problem, though, is that a lot of this evidence is based on studies that have been conducted with people who have more mild and moderate MS, so those that don't have such difficulty with walking. So this is one of the concerns when it comes to advanced MS, is that these benefits of exercise have not been established in this group. And so why? What are the limitations when it comes to exercise research and exercise studies in people with MS? So if we think about some of the kind of traditional exercise approaches that we might use, so like a treadmill or a bike, we know if people with advanced MS have walking limitations, this treadmill is a pretty scary thing. It's not going to be an accessible tool for people who have walking impairment. We can't be using the treadmill. Even the bike, for people who have more severe balance limitations, not necessarily a good approach that's going to work. And even a recumbent bike, we know that the foot pedals and kind of strapping your feet in there, keeping your feet in there, making that comfortable can be really difficult. How about on the resistance side of things? So this is an upper body shoulder exercise. So for people who have more mobility impairment, even just standing and balancing to be able to do that kind of exercise just might not work so well. Getting down to the ground to do maybe some abdominal exercises might also be really difficult. So we need to think about different approaches and how we can make exercise accessible for people with advanced MS. We touched on some other limitations that were pretty important in terms of exercise, and a lot of those that were, again, are specific to people with advanced MS. So we talked about availability of facilities and programs. So we need to have these types of programs available in the community setting, which is not always the case. Transportation, we heard Dr. Wynn talking about some options for transportation, but if you're in a rural setting, that might not be available to you. Okay? Some of these programs could be financially expensive. We require support in a lot of different ways to be able to exercise. And again, we also talked about needing information about how to exercise, what kind of exercise to do. And so the VIEW study that Professor Mottle talked about this morning about trying to get more information about how we can exercise. So these are some of the limitations that we face. So before we go on to some of the approaches for exercise for people who have advanced MS, it's really important that we just kind of talk about why this is so important. So we know long-term that disease-modifying therapies are ultimately not going to be effective in preventing the progression of disability and that accumulation of disability. We know in certain types of MS, like progressive MS, where those disease-modifying therapies have not been quite so effective. So we need some alternative tools for rehabilitation, for maintaining function, and improving, ultimately, independence and quality of life. So the potential solution, and what I'm going to talk about today, are adapted exercise approaches. So this could be in the form of modifications to traditional exercises. This could be just taking a slightly different approach, so maybe exercise in the home versus in a supervised clinical setting. Or it could be equipment, specialized equipment that's adapted for people who have more severe mobility limitations. So we're going to look at some different types of adapted and accessible exercise approaches this afternoon. So I'm going to talk about 4 different approaches for exercise training. The first is body weight supported treadmill training. We have recumbent stepper training, which is this device here. I'm going to talk a little bit about adapted home-based exercise, and then finally, functional electrical stimulation cycling. And I'm going to focus mostly on the last 2 because that's the research that we're focusing on right now in our lab, some of the studies that we're finishing up, and some new projects that we're going to be starting. So within each of these, I'll tell you a little bit about what the approach involves, okay? And what the evidence we have for this approach, and long-term, how it might be useful. So body weight supported treadmill training is a fairly novel approach. It's not available widely in a lot of different settings, so it might not be something that you're familiar with. But essentially what it involves is that an individual is suspended over a fairly traditional treadmill, And this harness system allows a certain amount of their body weight to be offset. So it makes it easier to walk, okay? The supportive harness also provides the safety, so we don't have the risk for falls. And we can provide assistance in the form of either manual therapy, so a therapist can move the participant's legs through the different phases of the gait cycle, or we can actually use an exoskeleton device to move the person's legs through the different phases of the gait cycle. And so we'll just hold. I don't know if this will play in here. Sorry. Sorry about that. That's not good either. Well, you saw the video kind of going there for a little bit. So that's manual assisted treadmill training. So we have therapists that are on either side of this patient who is practicing that walking movement, okay? And so we have some benefits so far in patients with MS. There have been some documented improvements in walking parameters, so walking performance, as well as gait. Some studies have reported improvements in muscular strength as well as spasticity. These are fairly small studies and often don't always include a control or sometimes have different types of control conditions. And one of the things that we've also noted is that when we stop this type of training and then just follow up patients long term, often those benefits are not maintained. So if you stop doing the exercise, the benefits are not maintained. This is one of the studies that I worked on, was part of during my PhD training, and we did a 12-week exercise, body weight supported treadmill training intervention. And in this group, this was specifically patients with progressive MS with also advanced mobility impairment. And we found some benefits there for quality of life and fatigue, particularly for this type of intervention, as well as some smaller changes in function in this patient group. So looking long-term at the potential of this approach, so obviously this is a very large, specialized piece of equipment. It's not available in a lot of different training centers, okay? So it's fairly limited in the reach of being able to reach a lot of patients with MS. It's a fairly costly piece of equipment, so it's going to cost several $100,000s for this type of equipment. So it's not the most accessible piece of equipment. The therapist-based training can be kind of ineffective in terms of staffing a rehabilitation center. So you have 2 to 3 therapists that are assisting in doing this type of training. So not always the most effective compared to other methods where we may have one therapist or even approaches that patients can do on their own. Also, if you saw a little bit in the video, the therapists are doing a lot of the work there. So it's possible that a lot of the benefits of the exercise, that this type of training is not as much of a cardiovascular challenge as other types of training, in that the patients are putting in a lot of, the therapists are putting in a lot of the effort rather than the patient themselves. So potentially it might be useful as a short-term treatment at a specialized center, and then long-term we might need to look at other approaches for maintaining function. So moving on to the recumbent stepper, that's this device here. So this is kind of a cool piece of equipment. If anybody has seen these or used these before, it's kind of like an elliptical but sitting down. So there's reciprocal arm and foot pedals, so that when you push with your arms or your feet, you're going to be having the movement reciprocally, and it provides kind of a full body, upper and lower body cardiovascular challenge. So it's a nice piece of equipment. It also has a lot of adapted features. So there's really large foot plates. There are The seat rotates 360 degrees. It's easy to transfer on and off of. There's also additional bracing for the legs to kind of keep the legs in place, and also hand bracing that can be incorporated as well to keep everything in place as you exercise on this equipment. So surprisingly, there's actually no studies that have been done in patients with MS that are published. We've done a small pilot study so far using this piece of equipment. We know in healthy populations that it's been shown to improve fitness, so there's been benefits for cardiovascular function, muscular strength, body composition, as well as in other patient groups like older adults or patients with Parkinson's disease and stroke. It's been used more frequently in these groups to show things like improvements in cardiovascular function, blood pressure, muscle strength, as well as balance. So we conducted a small pilot study that involved 12 patients, again with progressive MS, and we compared the recumbent stepper training to that body weight supported treadmill training system. We did 12 weeks of training, and patients came into our center 3 times a week to complete this exercise. They exercised for about half an hour on both of the pieces of equipment over the 12-week period. We looked at outcomes like safety as well as compliance. So are people doing it? Are people sticking with the program? And also patient experiences. So do people like using the equipment? How are they feeling after they use the equipment? Because that's important to gauge as well. We looked at some outcomes of, efficacy. Is the recumbent stepper as good as the body weight supported treadmill system? So what we found is that safety overall was pretty well established in both groups. We only had 2 adverse events for the stepper group and 5 in the supported treadmill group. So in the supported treadmill group, people found a little bit more discomfort with the harness, which is common. Some other bruising and kind of muscular fatigue with using the body weight supported system. Both groups we found good compliance, so about 90% compliance rate. People were similar compliance with using both of the different systems. And then in terms of preference, there was a little bit more, people rated the recumbent stepper a little bit more favorably. So people liked using that piece of equipment a little bit better. They found it easier to get in and out of. It was more accessible, and they thought long-term this would be a more accessible tool for them. In terms of secondary outcome, we found that both of the interventions were effective for improving fatigue and quality of life again. There were not as strong changes in this group for functional changes in terms of walking. Primarily, the benefits were for fatigue and quality of life. One of the things we did note was that with the recumbent stepper training, we found that participants could reach a higher exercise intensity while they were training. So their heart rate got about 20% higher using the recumbent stepper than using that body weight supported treadmill system. And so this might come back into, the therapists are doing more of the work than the patient is when it comes to the training. So this is a good approach as an alternative for the stepper for getting a better cardiovascular challenge, and that might translate into other important secondary health benefits. So long-term, the potential, so this is obviously going to be a much more cost-effective and easier piece of equipment to use than that supported treadmill, which is much larger and more cumbersome, okay? The training is a lot more self-driven, so patients can transfer onto this piece of equipment. They can set it up on their own in most cases and are able to carry out an aerobic exercise on their own. A lot of community settings, this is becoming a more popular piece of equipment, and it's being incorporated into a lot more community gym and exercise rehabilitation programs. So we're seeing these a lot more frequently. It could be used in the home setting, but again, it's a pretty large piece of equipment, so you'd need to have the space to be able to do it. I know some patients who do have them in their homes. All right, so we'll move on to adapted home-based exercise. So this is just a resistance training program that has been adapted for patients with advanced MS so that everything can be done in an accessible position. Everything is adapted so that it could be done in a seated position if necessary. We had some participants who were primarily wheelchair users, and we adapted all the exercises so that they would be able to do them from their wheelchairs if that were the case. Resistance could be really any form of resistance. So for our study, we looked at resistance bands, so kind of really heavy elastic bands that have handles on the end that allow you to do a variety of different exercises. But this could be in any different form, Okay, so could be, kind of traditional small free weights could be used as a home-based resistance exercise, or even just body weight, so doing exercises with your own body weight, kind of full exercises. And one of the important goals here is to really target that strength loss that happens in advanced MS. So we know that strength loss is important for a lot of other different outcomes, walking being one of the most important ones, as well as balance. So by doing this resistance training program, we're hoping to target that strength loss and then consequently improve other functions. So there's only one study that's been done before our pilot study that was a home-based exercise program. It was a very small study. There's no control condition. And so they did find some benefits for walking and function. And so we wanted to improve on that and do a slightly larger design with a control condition as well. So we did Project Retro. So this was a resistance training program for actually older adults that had advanced MS. So targeting the group that had some strength loss associated with aging as well as with advanced MS. And we did a 6-month exercise training program of this home-based resistance exercise. And so our goals here were to look at, again, safety kind of as a first step. We want to make sure that it's a safe approach. And does it work for improving muscle strength being one of the most important outcomes, and also trying to improve some of that lean muscle mass, so trying to regain some of that lean muscle mass. Some of the secondary benefits that we looked at were things like MS symptoms, quality of life, some of the other outcomes that I've mentioned before. And so the home-based exercise, as I mentioned already, we were using these resistance bands. They look just like that. And we gave the participants all the tools they needed to take part in this program. Okay? We provided them with logbooks. These are a little bit small to read, but they had logbooks where they could fill out all the exercises. They took this home and they did it on their own. And they had a training manual as well, so kind of as a reference. We also incorporated some behavioral strategies. So we used some strategies that are based on social cognitive theory to try to promote compliance and adherence with these exercise programs. I'll talk a little bit more about that in just a second. And we also incorporated some in-person visits, so it wasn't entirely home-based. We had participants come in to learn how to do the exercises with us initially. They worked with our trainers. And then we had about 5 visits over the course of 6 months to make sure people were doing the exercises appropriately, making sure that we did the right modifications that we needed to make sure that the resistance program was appropriate and always progressing so that we could see benefits. At the in-person training session, we also incorporated some of those behavioral strategies, which I'll go into next. So this is an example of some of the exercises that we're doing for upper and lower body. And so at the in-person training sessions, participants would come in and learn how to do these exercises. We'd go through demonstrations, we'd have them practice, and then we'd make any modifications as necessary because each person was individual and we needed to tailor the program so it would be appropriate for them. So our behavioral strategies really involve just tools and techniques to try to maximize compliance and adherence with the program. So we know that by incorporating these types of strategies, it helps to people to stick with exercise programs, whatever they may be. So we use things like self-monitoring, so using those logbooks to record what participants were doing, how they felt after the exercise, and we use that as a tool to monitor their progression and provide feedback. We also use things like goal setting, so we know that by incorporating goal-setting principles and setting good goals for the program, that helps people to provide an objective and direction for the exercise intervention. So this was an example of when people came in, they would do we would teach them the exercises and work through those, but we'd also do kind of mini lectures with our behavioral coaches. And so one of the techniques that we talk about is setting SMART goals. So appropriate goal setting using this SMART goal setting technique principles. So we would teach them how to use this, and then they would set a goal for the program. Again, just an example of one of our slides. So we would ask participants about what their personal goals were for the program, what they want to achieve out of the study, and how they might go about doing that. So that's just an example. So for Retro, we have 12 participants that have completed the study. 5 did the resistance training program. and we have 7 that were in a control group. So they, over the same 6-month period, just didn't change their activity. The average age was about 60 years old, and participants had had MS for just under 20 years. Going back to that EDSS scale, so our mean EDSS, or our median rather, was 6.5. So this would be somebody who's using an assistive device bilaterally most of the time. Okay. Safety so far, so we had one person report a shoulder injury. They had a previous shoulder injury and kind of aggravated it, so that may have been related to doing some of the upper body exercise. We had one fall that the participant reported outside of the exercise program, but it did happen during the same time period, and also 2 relapses were reported. So our compliance was about 45 sessions over the 24 weeks, and that was just about over 90% compliance, so pretty good compliance with the exercise intervention. So I'll highlight just a couple of changes that we've been seeing so far. We still have a little bit of more data to collect and add to this study. So in terms of strength, we saw a couple of advantages of the exercise program, some increases in strength primarily in the shoulders and also in the lower leg. So we're finding that the resistance training program is effective for improving strength in some muscle groups more than others. And so that might be related to the types of exercises that we're doing and something for us to think about moving forward. We found that lean mass, so basically muscle, is a little bit higher in our exercise group compared to our control group. Not a huge difference, but at least moving in the right direction. And some of the changes we're finding are more related to the exercise group maintaining their function and actually the control group losing some of their strength and muscle mass over the same period of time. Some other changes, so we found some benefits for cognition. So perhaps participating in this resistance training program is helping to improve cognitive function. So along the same lines as those mechanisms we're talking about this morning related to improving cognition through exercise. Also quality of life improvements. And interestingly, actually, pain, we didn't find an improvement with the exercise program. We found that pain was higher, actually, in our exercise group. So it may be that this resistance program isn't the best intervention to try to target pain in patients with advanced MS. So maybe a different approach would be better there, or perhaps we need to design our exercises a little bit differently. Okay. And so this approach, very cost effective compared to a lot of other exercise interventions, fairly easy to do in home and community setting. And we think kind of including these strategies that involve behavior change techniques and different tips for promoting compliance are going to be really important if people are exercising on their own at home. So the last one we'll touch on is functional electrical stimulation cycling, and this is a study that we're just getting started. And so essentially what it involves is surface electrodes that are placed on leg muscles, okay? So for leg cycling, we do that on the upper leg muscles at the front and the back, and it delivers a mild electrical stimulation pulse to help to contract those muscles and induce kind of a higher exercise training stimulus and also some feedback to the central nervous system. So there are some benefits that have been established and primarily come from spinal cord injury and stroke populations. So that's really been the focus of this type of research, and only now are people moving to use this type of approach for patients with MS and particularly advanced MS. There have been a lot of really important benefits in spinal cord injury and stroke for trying to increase function, improving walking, improving strength, a lot of really good benefits of this type of intervention. So there's some small studies, very small studies that have been done in MS patients so far, only about 4 interventions that have been done, and often not with really a control condition either. So you're seeing a pattern here of all of these studies, and we're just starting to really get into studying exercise for patients with advanced MS. And so there have been some benefits of this approach so far, primarily for walking and increasing muscle strength. And so we want to test this further, and we want to design a study a little bit better. So the next thing that we are embarking on right now is a 6-month training study involving supervised functional electrical stimulation cycling. We are going to recruit 16 patients who have progressive MS, and they'll be doing two different types of leg cycling. So one will be functional electrical stimulation leg cycling, and one will be a passive leg cycling, which will be just cycling on the leg ergometer, but without the stimulation, to try and see what would be the added benefit of including the stimulation as well. Okay? Again, we're going to first start by establishing kind of that safety and feasibility. So is it safe, and does this intervention work? And then looking at other secondary outcomes that we know are important, like those MS symptoms, quality of life. And also, interestingly, we received some additional funding to include some brain imaging with MRI, so we're really excited about being able to include that in this study as well. So FES cycling is FDA approved for home use. Many people with spinal cord injury and stroke do have these devices at home. What's really cool about these devices is that they are connected to the internet, and they can provide feedback from your training session. Could go directly to a rehabilitation center, and you can provide feedback on the patient. Or if you were taking part of a training study, you could be doing your study at home, and then I would get an email about what your training session involved, exactly what you did, and then we could provide you with some feedback. We might be able to increase kind of the training stimulus by providing, we're doing this cycling exercise, so that's a great cardiovascular workout, but then we have the additional leg stimulation, so that might be able to kind of increase that maximal exercise stimulus and provide more adaptations to exercise. So our next steps are going to be to first establish this in patients with MS, and take the next steps to try to do larger studies of this type of intervention. So I just want to touch on some other rehabilitation considerations. I know we've heard a little bit about this already today. So we know that these strategies, we don't have to think of these kind of exclusively as strategies that we might use. They can be used in combination with other types of approaches. So we heard about, the importance of physical therapy, the importance of assistive devices, finding the right assistive device, making sure it's sized properly for us. And then obviously there are going to be other medical and surgical therapies, like things, our treatment of spasticity with certain medications. Okay, so all of these things we're gonna use in combination. So I'll conclude there. Like I mentioned before, this is really just the beginning of finding solutions for exercise for patients who have more advanced MS. I've touched on a couple of different approaches, but there's lots of other approaches as well. We've looked at some arm cycling exercise, just upper body. That's another approach as an example. And we need to do a lot more studies, so we need some really well-designed studies. That's a flaw of much of the research that's been done so far is very limited small samples and without appropriate control conditions. So we need to do some really high-quality studies to get some good evidence on these types of approaches. Ultimately, the goal for all of this is to create the most effective approaches for managing advanced MS, and hopefully we can do that in the home and community setting to try to reach the largest number of people who have MS. So in that, I'll conclude. I just want to thank all the participants who are taking part in this research. We know it's difficult for that to happen, and we're very much appreciative of their time and commitment to our studies. The rest of our research group, graduate students and undergrads that have helped to be involved in these training studies, and our collaborators, you've heard lots about the Exercise Neuroscience Lab and Professor Model already, and they're such an integral part of our research program. So we're very, very thankful for their collaboration. All right, thank you very much.
We have about 10 minutes for Q&A, so I'll come over here on this side and Carrie will be on that side. So just raise your hand if you have a question and we can walk on over to you.
Hi, I actually have two questions. The first one is about the FES cycling. When you showed the benefits, it mentioned spasticity for the stroke patients and spinal, but not for the MS patients.
Right.
And any ideas why, or?
Yeah, so that's really just presenting what's been done so far, not to say that it couldn't be beneficial. So spasticity has not been measured in any of the studies. There might be, nope, I don't think there is actually. So it hasn't been measured in any of the studies that have looked at the benefits of FES for people with MS. So it's not to say that it couldn't be a benefit, and it probably could be. So that's something that we certainly hope to address moving forward.
And the second question, have you done any studies with rowing machines? And if so, is there any particular type you would recommend?
Yeah, so I have not done any studies with rowing machines. I haven't been involved in any. But that certainly could be another approach. Like I mentioned, I think there's a lot of different tools out there. I've just touched on a few, and we've only started to take a look at what the other approaches are. There's actually some, in spinal cord injury, they've done FES rowing. So they've done the rowing with the electrical stimulation on the legs as well. That's kind of an interesting approach, and they've found a lot of benefits in the SCI population for getting a really good cardiovascular workout. Yeah.
How did you decide the number of participants? You mentioned 12 and that they're looking for 16.
Yeah. So for each study, it's a little bit different. So sometimes we have some evidence in other populations that allow us to use kind of the strength of the benefit that we've seen in another population to calculate a sample size. So that's based on the power that we achieve in that study. There's other things that go into it in terms of just kind of feasibility of what we can accommodate in our training centers and the amount of hours for staffing that will be necessary to be able to carry out those types of projects. So we usually base it on previous studies and what are the results, and we use some calculations to then come up with the number.
Yes, I have a question. I tried PT and they gave me a hassle about being over the cap. And then I talked to somebody and they said that they would work with me, but they've been giving me hassles all along.
In terms of insurance, is that?
Yeah.
Yeah. I'm not sure exactly. That might be kind of a specific situation. I'm not sure what.
Get your results or anything, or we could give it to somebody, or?
Sorry, can you say? I can't.
Get your results so we can give it to the providers, or?
Yeah, I mean, that's certainly something we're happy to share our results and what we know so far about the benefits of this type of exercise. There was some talk earlier this morning about, writing scripts for exercise and physical therapy. And I think it's kind of an individual base in terms of what coverage would be allowed depending on your provider.
Following up briefly on something Dr. Model said this morning, which you've shown in your exhibits, has there been any research done on core body temperature during exercise and how it correlates with your findings? Because what he said regarding swimming not being that therapeutic to people with MS, you're talking about an exercise, if you're talking a cool water pool or even a regular pool where the temperature of the pool is going to bring down your core body temperature, and normal exercise will normally inflate it.
Yeah. So a couple things there. So sometimes that's the case, but sometimes community programs keep pools a lot warmer than they probably could be. So that can be a little bit of a challenge. I know I have heard that from patients kind of complaining that the water temperatures are too warm. I think kind of the seniors programs like to keep the pools a little bit warmer. So I think in Dr. Model's group, they are doing some work on changes in core body temperature with exercise. They've invested into some sophisticated sensors to be able to check those changes with exercise. I don't know their findings on that so far. I know there's really no other evidence out there on what are really the specific changes with exercise, but something that will be coming soon. Yeah. But great question.
I was wondering if you collaborate with any other researchers who are doing work in these areas. Specifically, I was thinking about Dr. Terry Walls at University of Iowa, who is an MS patient and credits some of her physical recovery to using electrical stimulation.
Yeah. So we haven't collaborated with them, with that group so far. I know Dr. Model has, I think, had some discussions with them before, so that might be something that they move forward with. My collaborations have primarily been based with the team at U of I, so we have quite a few researchers that are involved in exercise and MS research there, as well as the group up at McMaster that Professor Model mentioned earlier, and Queens.
What about, New Step?
New Step?
Yeah.
Yes. So the New Step, so that's the recumbent stepper study. So that's the one I talked about, the second one on there. They're kind of New Steps. There's the manufacturer of those recumbent steppers. Those are, so like I mentioned before, there's no published studies on that. We have one pilot study that's been done so far. I think there's a lot of potential with the New Step. People love using it. I think you get a really good cardiovascular challenge compared to a lot of the other exercise approaches. I think that's a limit to a lot of the training interventions for patients with advanced MS. And the New Step is nice because you get a full body exercise. And we've done some acute studies just looking at what's the maximal response to exercise using a New Step versus just an arm ergometer. And we find that the aerobic response is about 30 to 35% higher, your maximal aerobic exercise response using the New Step. And that's primarily because you're using more muscle. It's a full body exercise versus just upper body exercise. So I think there's a lot of potential there. Vibration. Yeah. So the question was about power plate vibration. If anybody's familiar with that, it's kind of a base that uses vibration training, and they've done it in some other populations. And I think there is some evidence in MS. We haven't done any of that training with our lab group. But I think there's some other research related to particularly bone density and improvements with bone density with that type of training. It's not something that we've been involved with, so I'm not as familiar with those. Yeah.
I have a question. How are participants recruited? I mean, is it posted on the internet like we're doing this and you're all going to get bikes and you're going to be tested and all that kind of stuff? How does that
Yeah,
work?
so we have a lot of different venues that we recruit. We try to share our information and our research as much as possible. We have a website about our lab that provides all the information on the studies that we have going on, as well as the ENRL. They have a website as well. Through the university, there's information about our programs. We try to visit MS Society events as much as we can to try to kind of spread the word on what we have going on.
Because if we don't know about it, we can't
absolutely
participate. Well,
yeah,
that's wonderful.
so,
Thank you.
And feel free to come and talk to me, and I'm happy to give you more information. Yeah.
The lack of balance trainings for
Yeah.
over 20 years, I've had the balance ball at home, and right now I'm finally using band standing. It's really good for my balance.
Yeah.
Do you have any recommendations?
Yeah. So the question was about balance training and recommendations. Using some of the resistance bands can be kind of a combined balance type of exercise as well, because there's a lot of stability there. So we're using a lot of core stability and balance training at the same time. We've done some balance training in some of the other studies with Professor Model's group. They've done different balance tasks, standing on one foot, tandem stance, a variety of different kind of balance training activities. We find too just the improvements through particularly like muscle strength will translate into benefits for balance. But we don't have right now any specific balance training program, but I think it's definitely something that needs to be incorporated with other activities as well.
Hi, I just had a quick question for kind of the layperson outside of a study, and I find the recumbent bicycle option very interesting.
Yeah.
So if I would go to my local health club, should I first work with a physical therapist, or do you have an idea of, where's a good starting point? Like how many minutes on a recumbent bike?
Yeah. So that's. I think you have a lot of options there. I think you can work with a physical therapist or a trainer who might be a little bit more familiar with MS, or just somebody who's a little bit more exercise background. If you feel more confident, you can go to those physical activity guidelines for people with MS. They provide a lot of information, and there's also some toolkits that go along with it that are more information for patients with MS and how to start being active. Yeah, so those are the Canadian Physical Activity Guidelines for people with MS. If you, MS Society of Canada or the Canadian Society for Exercise Physiology has published those online. If you just search for those MS Physical Activity Guidelines, you should be able to find those. And within those websites, they have more information and tools. So generally, as a recommendation, if for somebody who's sedentary, who hasn't started exercising, and whether or not you have MS or not, starting with small amounts of activity and building your way up. So that might be 10 minutes to start. Like Professor Model said earlier, kind of gauge your own response. See how you feel. Seeing how you feel after exercise too. So right after and the next day, and think about, am I feeling too tired? Did I overdo it too much? Do I feel like I could have gone harder? And gauge that to move forward. And another thing, too, that he said is really important is that you can accumulate those bouts during the day. So if our goal is to get to 30, we could do 10, 10, and 10 spread out throughout the day. And that's been shown to have the same benefits for our health as doing that bout all at once.
Okay, I think that is enough time for today. We want to thank Professor Paludi again for coming out and speaking. We're going to take a quick 10 to 15 minute break. There's going to be some juice outside, so if you want to grab some and then go on to your next breakout session. And also just to remind you that we do have the surveys, so please fill those out and then turn them in the back on your way out.
If anybody has more questions or wants more information about the exercise, please come and talk to me. Okay. Let me turn this microphone on.